Alright, I've got another question to answer. I hope it won't take me too long, but you never know with me. I know it's a long comment. You can stop and read it if you want. I'm not going to because the main part, the main question part, is in this paragraph. Oh, my finger disappeared. What did I mean by complex mental illness and therapy for schizoid personality disorder? To be honest, I didn't have any particular definition in mind. I kind of just pulled it out of the air, complex mental illness. But it is a thing, and pretty good definition is on the SANE website, because they deal with a lot of complex mental health issues. Mainly schizophrenia, though. I did look into them when I was, when I first got diagnosed with schizoid, thinking, if they do complex stuff, maybe they can help me, but they don't talk about schizoid at all. I know, schizoid can be on the schizophrenia spectrum, but I think it depends on what it's caused by, and I don't think I have that type, so they wouldn't be interested in me, I figured. Anyway, let's scroll down to the relevant bit. Here we go. What they talk about. It includes people who are affected by high levels of psychological distress, a history of traumatic events and complex trauma, symptoms and experiences that are impactful, severe, enduring, episodic, or not well understood. And it could be all of them, it could be one of them. And they also give some examples, so as I said, schizophrenia and psychosis, because that is a pretty full-on condition. And yeah, their main focus. So, in that part, I just glossed over the paragraph above it, but, it could be, it's just basically mental illness that is really challenging to manage and impact on their lives in a more significant way. Trouble managing strong and intense emotions, unusual beliefs, behaviors, and the impacts of trauma. So, depression, pretty much any mental illness is going to have a difficult impact on people, but there are some that are, harder to treat, more severe, have just, schizophrenia. When someone's having an episode, all kinds of things can happen. People can get into a lot of trouble. So there's that. They listed bipolar disorder. I guess, being manic, you can get into a lot of trouble. Probably more so than depression, depending on how bad your depression is. Borderline personality disorder. Notice they never give a crap about other personality disorders, only borderline. To be fair, borderline is very dramatic, but I would argue that pretty much any personality disorder is complex because they're just really deep-seated conditions. And so, how do you treat them? It's difficult. And, the treatments for borderline often get used for other personality disorders. But that's the most studied one, anyway. Obsessive-compulsive disorder, post-traumatic stress disorder, and complex PTSD, which I think isn't a fully defined thing, or it's not a diagnosable thing, but it's a concept that's talked about. So the difference between PTSD and CPTSD is PTSD tends to be one significant event in a short period of time or something like that, whereas CPTSD tends to go on for years and years and years. You could argue that I have something like that, except that I don't have the symptoms of PTSD. So I have complex trauma, but maybe not complex PTSD. Words that I think, sometimes they confuse things. Anyway, eating disorders, very difficult. Dissociative disorders, severe depression and anxiety. There you go, severe depression, as opposed to milder forms of depression. They also support people with autism, ADHD, or intellectual disability, who also experience mental health issues. But autism, ADHD, and intellectual disability, those are sort of neurodevelopmental conditions. They're not really mental illnesses in themselves. And then they've got other things you can look at. Causes, living with, treatment, support, blah, 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 blah. Anyway. Basically, complex mental illness is just difficult mental illness. It can also be having multiple conditions layered, which Patrick mentions in this big chunk here. But so in my case, I have schizoid personality disorder, depression, which has involved both major depressive disorder and dysthymia. So I had double depression. Don't know how much I qualify. I probably have ongoing dysthymia. Not currently in a depressive episode, cross fingers. I can crash, but not for 2 weeks at a time, so it's technically not major depressive disorder at the moment. And then I also have some kind of dissociative issues, but, you know, they mentioned on this website dissociative disorders. I'm not sure that what I experienced would count as a disorder, but it is a confusing symptom. Complex mental illnesses, I think also the causes can be complicated, and the treatments, which brings us to therapy for schizoid personality disorder. I don't want to go on about it too much because I think I talked a bit about it in my last video, the abolition one, and like I kind of bring it up every now and then. But the other thing is, because I have more than just schizoid, I can't really tell you, I mean, it's hard for me to tell you from my own experience what therapy for schizoid is like, because I'm not just being treated for schizoid, I'm also being treated for depression and trying to work out the dissociation type stuff. Yeah, so I'm gonna say it depends, and it also depends on what the cause is, because if someone has more schizophrenia-ish schizoid, like premorbid or just negative symptoms of schizophrenia, or a chemical cause for schizoid, you probably want to go on medication. And even then, for negative symptoms of schizophrenia, they don't have good medications, so good luck to you. I don't know if standard antidepressants can help with that. But, I don't know, you never know, maybe. Mild antidepressants probably aren't that bad to try, unless you have, you know, mania hidden under there. Which I don't think you would if you're a schizoid, but what do I know? So, like, relatively safe to try, especially the mild ones. Whether it helps, I don't know. As for therapy, if you're like me and the schizoid is probably caused by trauma, well then digging into that trauma in a safe and supportive environment, all those keywords, might help you figure out stuff. Maybe also managing what you can cope with. So a lot of schizoids will get solitary jobs and seem to do well there. Maybe it's about trying to figure out how you can adapt your circumstances to fit what you can cope with your personality disorder. So like some of it would be digging into why you have that disorder and maybe finding a path out of it. But personality disorders are very entrenched, so it's a lot of work. If it's not possible to overcome the disorder completely, then managing your life and finding a way that you can exist that's less distressing, that might be it. But yeah, I mean, I don't know what's successful because I'm still how I am. I guess like understanding my disorder and understanding how I got this way is helping me challenge myself to try things, be different, consider things. But yeah, I mean, I also have depression, and I know schizoid and depression can get pretty mixed up. Not everyone who has schizoid is depressed though, but things like anhedonia in there, that sort of overlaps with depression. So some of what I talk about in therapy might be more depression oriented, but there is overlap, so how can you tell? And then of course the dissociation. I mean, people with personality disorders often lack a solid sense of identity, and dissociation, I mean, it's not just identity stuff. Dissociation can involve depersonalization, so if you feel like you're watching yourself, I can imagine some schizoids might feel like that, especially if they get really bogged down into fantasy and they're sort of, well, maybe is it derealization, or is it just detaching from the current situation if you're just off in your fantasy world? Daydreaming is technically dissociation, and I think daydreaming, there is a daydreaming disorder, or it was starting to be recognized as a disorder, people who chronically daydream. That would be a form of dissociation, but it's not strictly schizoid. So yeah, I don't know how much I can tell you about that, but, you know, follow the advice in the abolition video where I talked about how to find a therapist. You definitely want to mention you have schizoid and make sure they know what that means, because otherwise they're going to treat you like anyone with depression, and that stuff doesn't seem to work for us, as far as I can tell in my experience and experiences I've heard. Yeah, therapy for schizoid. I had a thought and it just escaped me, and now I'm like, oh no, I'm gonna sit here wondering, and if I don't talk about it now, it's gonna annoy me when I finally do think of it. Oh, I'm just gonna make random noises until I can remember what it was, but I like this, like, further over there, my hand's gonna disappear, there it goes. Kinda lost my train of thought, yep. That's relatable, isn't it? Anyway, oh, but Patrick's saying, they haven't been diagnosed yet. I mean, I've also made videos on self-diagnosis and also whether or not you should get diagnosed, so I guess I can put them in the description somewhere or leave a comment and pin a comment with some links for that if I remember to. Yeah. I probably could have kept going, but damn, I made myself laugh. I don't know. Has anyone watched The Grudge? I watched it both in Japanese and the American version, and they were both just really very silly. I'm not good with those horror movies because they tend to just be so over the top that you can't really, like, I can't suspend disbelief. Oh no, I can't remember what it was that I was thinking about, so maybe I should just end the video and make a separate one if I remember whatever it was. Therapy for schizoid. I was talking about depression, I was talking about schizoid, I was talking about dissociation. No, brain doesn't want to do it. I'm just gonna end the video. I gotta get to bed.